So we want to know what are the causes of failure so that we can avoid vaccine failure. As I said, we want to make sure that we make every post a winner. The most common reason that vaccines don't work in shelters is that animals came into our shelter already incubating that particular infectious disease. And there's not a lot that we can do about that sometimes. So I'm not saying don't vaccinate, of course. The only hope they've got is vaccination. But we don't need to really self-flagellate too much, because sometimes the problem is not of our making. Often these diseases are in the incubation phase when we're admitting the puppies into our shelters. Interference, we know about maternal antibody interference. There can also be interference if you give a vaccine too often. So a lot of shelters, including the shelters that I'm associated with in the Midwest, do vaccinate every 2 weeks, but every 2 weeks is the most frequently that you should be vaccinating, because if you vaccinate more frequently than that, then that second vaccine the first vaccine may interfere with the response to the second vaccine because of the antibody titer that was stimulated from the first vaccine. Improper storage. It is really well worthwhile your time to take out the manufacturer's instruction leaflet when you buy a new batch of vaccines and just spend the 5 minutes reading those instructions. You can't expect these vaccines to work unless you follow the manufacturer's instructions exactly. It only takes 5 minutes to read the leaflet, and it's well worth doing. You've got to make sure that your refrigeration is optimal, and that you're not keeping modified live vaccines in the freezer compartment, of course, because you're going to kill that infectious agent. They're not supposed to be kept in the freezer. Those ones go in the refrigerator. And as I said earlier, you should be discarding any vaccines if they are still sitting around on your countertop after 2 hours after they've been reconstituted. You should always use just one vaccine per syringe and needle, single use, of course, and always use the diluent provided by the manufacturer. That's really not a corner worth cutting. You need to make sure that the vaccine and the diluent go together. They're made to go together if you want to achieve the results that you're hoping for. So there can be administration problems with the wrong route. As I told you earlier about Bordetella bronchoseptica is the one that we think of the most often with dogs. And if that does happen to you, often people will try locally instilled gentamicin in a saline infusion and oral doxycycline. You should also contact the vaccine manufacturer. There's a lot of talk about which place you give cat vaccines, but we don't have any specific guidelines at this stage for giving dog vaccines. This talk was based on the very latest information from the AHA 2011 canine vaccine guidelines. And what that document tells us is that you should administer rabies vaccine on the shoulder, and you should also make a note of exactly where you have administered any vaccines. So there's not set guidelines like there are for cats yet, but just really some suggestions just in case problems occur later on. Spillage. We encourage you to clean up any countertops if there's spillage on countertops with a 1 in 32 bleach solution. If the spillage on the fur after you've administered the subcutaneous vaccine, then you clean that up with alcohol. You shouldn't be swabbing before you administer a modified live vaccine, because as the needle goes through the skin, it may take up a little bit of the alcohol and kill that virus that's in the modified live vaccine. So this is one case where you should swab afterwards.